The Tuskegee Syphilis study remains one of the most haunting examples of institutional betrayal in American medical history. Conducted between 1932 and 1972 by the U.S. Public Health Service (PHS) in collaboration with the Tuskegee Institute, this study was framed as a public health initiative aimed at understanding the progression of syphilis in black men. In reality, it was a 40-year-long deception that weaponized trust, exploited poverty, and sacrificed truth for data. The study enrolled 600 black men from Macon County, Alabama 399 with latent syphilis, and 201 without the disease as controls. These men were never informed of their diagnosis. Instead, they were told they had bad blood, a colloquial term encompassing a range of ailments from anemia to fatigue. This euphemism was the first veil drawn over the study's true nature, and it would not be the last. The men were promised free medical care, meals, and burial insurance. These offerings were not acts of compassion but tools of manipulation. The study's architects understood the economic vulnerability of their subjects and used it to secure compliance. What the men received instead of treatment was a series of diagnostic procedures disguised as therapeutic interventions. Lumbar punctures, for example, were described as spinal shots meant to cure their condition. In truth, these were painful tests used to track the neurological effects of untreated syphilis. Even after penicillin became the standard treatment for syphilis in 1947, it was deliberately withheld. The researchers wanted to observe the full arc of the disease, even if it meant watching their subjects suffer and die. This decision marked a turning point not just in the study's trajectory, but in the ethical landscape of American medicine. The withholding of penicillin was not a passive oversight. It was an active choice. It revealed a chilling calculus. The lives of poor black men were deemed expendable in the pursuit of scientific knowledge. This logic was not isolated to Tuskegee. It echoed broader patterns of racialized medical exploitation. From gynecological experiments on enslaved women to the unauthorized use of Henrietta Lacks cells, Tuskegee was not an anomaly, it was a symptom of a deeper institutional pathology. The study continued for 4 decades, sustained by a network of complicity. Local doctors, nurses, and administrators participated in the deception. National agencies provided funding and oversight. Academic journals published the findings without questioning the ethics. The silence was deafening. It wasn't until 1972, when a whistleblower named Peter Buxtun leaked details to the press, that the study was finally exposed. Public outrage followed, and the study was terminated. But the damage had already been done. At least 28 men died directly from syphilis, 100 from related complications. 40 wives were infected, and 19 children were born with congenital syphilis. These numbers, though staggering, only hint at the deeper wounds, inflicted wounds of betrayal, mistrust, and generational trauma. In 1974, a $10 million settlement was reached, and in 1997, President Bill Clinton issued a formal apology. He acknowledged the government's role in the deception and the pain it caused. But apologies, while necessary, are not sufficient. They do not erase the legacy of harm. They do not restore the lives lost or the trust broken. The Tuskegee study left a scar on the American psyche, particularly within black communities. It fueled skepticism toward medical institutions, a skepticism that persists to this day. Vaccine hesitancy, mistrust of clinical trials, and reluctance to seek care are not irrational. They are rooted in lived experience. The ethical fallout from Tuskegee reshaped the landscape of medical research. It led to the establishment of institutional review boards, IRBs, the codification of informed consent, and the creation of the National Research Act. These reforms were designed to prevent future abuses, to ensure that subjects are treated with dignity and respect. Yet the deeper reckoning lies not in policy, but in narrative. Tuskegee is not just a case study in bioethics, it is a mythic wound. It embodies the archetype of the wounded healer, where institutions meant to protect become sources of harm. The men of Tuskegee were not merely victims, they were sacrificial subjects offered up on the altar of scientific progress. This mythic framing invites a different kind of analysis, one that centers survivor experience, honors autonomy, and interrogates the systems that render certain bodies expendable. The study's architects operated within a paradigm of control where knowledge was extracted rather than the subjects were not collaborators in the pursuit of truth. They were objects of observation. This dynamic mirrors broader patterns of institutional control, where marginalized communities are studied and managed rather than empowered. Tuskegee reveals the dangers of a medical model divorced from empathy, one that prioritizes data over dignity. The legacy of Tuskegee also intersects with cultural memory and ritual. For many, the study is not just history, it is ancestral trauma. It is a story passed down through generations, shaping how families engage with medicine, authority, and disclosure. This intergenerational transmission is itself a form of ritual, a protective mechanism that encodes caution and discernment. Survivors and their descendants carry this legacy not just biologically but symbolically. They embody the archetype of the truth teller, those who bear witness to injustice and demand accountability. In this light, Tuskegee becomes a portal, a site where myth, history, and healing converge. It challenges us to move beyond apology and reform toward transformation. This means reimagining medical research as a collaborative, survivor-centered practice. It means honoring the wisdom of those who have been harmed, integrating their insights into protocols, policies, and pedagogy. It means dismantling the hierarchies that privilege institutional authority over lived experience. Tuskegee is not just a cautionary tale, it is a call to action. This call extends beyond medicine into the broader realm of cultural and political discourse. The study's logic of control, concealment, and sacrifice mirrors patterns found in other institutions. From law enforcement to education to religion, Tuskegee teaches us to recognize these patterns, to name them, and to resist them. It invites us to build new mythologies, ones rooted in transparency, consent, and care. These mythologies are not abstracted. They are practical frameworks for discernment and empowerment. For educators, Tuskegee offers a curriculum in ethical complexity. It challenges us to teach not just the facts, but the frameworks. To explore how language like bad blood can obscure truth, to examine how power operates through silence and complicity, to engage students in the work of narrative repair, where history is not sanitized but This pedagogical approach honors the intelligence of survivors and equips learners with tools for transformation. For activists, Tuskegee is a rallying cry. It underscores the importance of vigilance, of whistleblowing, of community accountability. It reminds us that institutions do not self-correct, they must be challenged. The study's exposure was not the result of internal review, but external pressure. This truth affirms the role of grassroots advocacy in shaping policy and protecting autonomy. It also highlights the need for survivor-led movements, where those most affected define the terms of engagement. For healers, Tuskegee is a mirror. It reflects the ethical imperative to center care over control, relationship over research. It calls for a reorientation of practice where healing is not a transaction, but a collaboration. This requires humility, transparency, and a willingness to confront history. It also demands ritual acts of remembrance, storytelling, and symbolic repair. These rituals are not performative. They are transformative. They create space for grief, rage, and renewal. Ultimately, the secrets of the Tuskegee Syphilis study are not confined to archives or court documents. They live in the bodies, memories, and mythologies of those who were harmed. They speak through silence, through skepticism, through the refusal to forget. They challenge us to reckon with the past, not as a closed chapter, but as an open wound. This reckoning is not comfortable, it is necessary. It is the foundation upon which ethical practice must be built. Tuskegee is a story of betrayal, but it is also a story of resistance. The men who endured the study, the families who carried its legacy, the whistleblowers who exposed its truth all are part of a lineage of truth. Their courage invites us to listen, to learn, and to act. Not just in medicine, but in every domain where power meets vulnerability. Their story is not overwrit, is a living myth, a guidepost for those committed to justice, autonomy, and healing.